Hello everyone, my name is Gustavo Adolfo Cardoso. Today is June 9th of 2021. This is my case connection video presentation. So for this assignment I chose case scenario number 2 and number 3. Please excuse me in advance, my throat's bothering me a little bit. So for case 2, it talks about a 16-year-old female who is recently diagnosed with a deficiency in muscle glycogen phosphorylase. Her family and herself are concerned about the following questions, blah, blah, blah. Please explain it. Okay, so for question number 1, it goes, I'm not sure I understand the issue. Can you explain how muscle glycogen is used normally during exercise? So muscle glycogen is solely meant to provide ATP for the metabolic needs of the muscle itself. It does not contribute to overall plasma glucose levels because it lacks glucose 6-phosphatase, an enzyme that, in the fasted state, dephosphorylates glucose 6-phosphate and converts it into glucose. This happens in the liver. As a result of not having this enzyme, skeletal muscle glycogen is not released from the tissue itself, and so it does not contribute to plasma glucose. In the muscle, glycogen phosphorylase is the enzyme that breaks down glycogen and frees up glucose 1-phosphate, which enters glycolysis to generate ATP in what's called glycogenolysis, right? Along with the formation of pyruvate or lactic acid. It is important to mention that the signal for cyclic AMP formation, or CAMP, which activates glycogen phosphorylase, is initiated or provided by the hormone norepinephrine, which is analogous to epinephrine in the sense that it contributes to the fight or flight response by increasing breakdown of fat and glycogen, as opposed to glucagon, which occurs in hepatic tissue or the liver. So in the fed state, the primary role of glycogen in muscle is to provide a source of glycogen phosphate so that it can be converted to glucose 1-phosphate and eventually be stored as glycogen, or glycogenesis. So here, this cascade of events is initiated by the presence of insulin, causing the take-up of glycogen from the bloodstream while simultaneously inhibiting glycogen phosphorylase. Okay, so question number 2. It basically says that the patient likes to take long walks. She's going to be able to do that with her friends. The answer here is absolutely yes. Going for long walks is an aerobic activity, and skeletal muscle utilizes glucose both aerobically and anaerobically, producing CO2 and forming lactic acid respectively. In her case, she would need to avoid fast, rapid, explosive exercises or activities which rely heavily on glycolysis or anaerobic metabolism, the initial pathway for generating ATP, which is utilized by the body. So it might be contraindicated. However, if the patient wants to engage in exercise, she must do so with caution. Some muscle damage may occur. So question number 3, it says, as a result of this deficiency, will I need to get up at night in order to maintain my blood glucose levels? I believe that there's no need to get up at night and eat something in order to maintain blood glucose levels, since plasma glucose in the fasted state falls moderately and then changes a little as fasting is prolonged into a starvation, which she's not going to go into a starvation. In this case, non-esterified fatty acid metabolism would increase in order to supply the brain with ketone bodies as a form of energy. And this is true as the concentration of glucose from carbohydrate intake decreases in the small intestine, so does the secretion of insulin, causing adipose tissue and skeletal muscle to reduce their glucose intake or storage into glycogen. Additionally, as already mentioned, the primary use of muscle glycogen is to provide glucose 6-phosphate for generating ATP within the muscle itself. And since during sleeping, typically, unless she sleepwalks, there is minimal body movement going on. It means that no substantial amounts of energy are required at this point. In other words, the patient is not really moving enough in her sleep to require significant amounts of energy or food intake in the middle of it. Moreover, there should be plenty of glycogen reserves in her liver, since there's no problem here, in order to maintain her body while she sleeps and to carry out glycogenolysis. Right? Question number 4, it reads, do I need to worry about producing excessive lactate during intense aerobic and anaerobic exercise? Personally, I think the patient should be worried about intense anaerobic activity that may result in excessive lactate formation, which can lead to lactic acidosis. However, considering that the patient does not lack hepatic glycogen phosphorylase, responsible for von Gurk disease, I hope that's how you pronounce it, which impairs the proper functioning of both glucogenesis and glucogenolysis, she should be fine for the most part, following, of course, adequate rest times between each exercise. I support this statement because lactate can be utilized as a substrate for gluconeogenesis by the liver, and additionally, the patient's pyruvate metabolism is not impaired by her condition, which really tends to lead to lactic acidosis. So case number 3, I picked this case because I kind of like to think and trying to figure it out about what's going on with someone, with the patient. So this case talks about a 5-year-old boy who was brought to the pediatrician, and her mother says that the infant appears to be drowsy, always thirsty, and with frequent urination. So there are 3 questions to answer here. The first one is, what is the information likely to suggest about the underlying biochemical basis for the patient's symptoms? So based on the patient's age and symptoms displayed, along with the results from his glucose loading test, it is fair to say that the patient is suffering from diabetes mellitus type 1. This is an autonomic metabolic disorder that is controlled by the action of the hormone insulin, as well as glucagon. So insulin is a pancreatic hormone that helps convert and store blood glucose into energy in the form of glycogen. Under normal conditions, insulin is secreted as a direct response to hyperglycemia or high blood sugar, which then stimulates the liver to store glucose as glycogen and increases the uptake of glucose into extrahepatic tissues such as skeletal muscle. So this lack of insulin hormone leads to hyperglycemia, causing the blood to become acidic and eventually resulting in ketoacidosis, which is a typical condition experienced by diabetes mellitus type 1 patients. So ketoacidosis causes a series of symptoms that coincide with those of our patient, such as excessive thirst, frequent urination, and extreme weakness, or in this case, drowsiness. So the absence of insulin to regulate glucose in the patient's body inhibits glycogen synthase and activates glycogen phosphorylase, the enzyme that breaks down glycogen and frees up glucose 1-phosphate, which then enters glycolysis to generate ATP or glycogenolysis. And this, in my opinion, is what explains the boy's apparent lack of energy. Okay, question number 2. What would you predict the patient's fasted blood glucose levels will be given his current condition? So based on the discussion just a minute ago, I would predict the patient's fasted blood glucose to be elevated when compared to normal blood glucose levels. And this is due to the fact, obviously, that the patient's cells lack the insulin necessary to capture and process glucose. Okay, and finally, question number 3. So based on these diagnoses, what 2 regulatory enzymes are likely to be active in the individual's current condition? So I would expect phosphofructokinase 1 and pyruvate kinase to be elevated in the patient's current condition. I come to this conclusion because pyruvate kinase, for instance, is inhibited by ATP and glucagon, both of which are in reduced levels given the patient's inability to metabolize glucose for energy. PFK1 would also be active in the patient because just like pyruvate kinase, it is inhibited by ATP as well as AMP, which again is kind of lacking in the patient at this moment given his condition. And additionally, abundant amounts of glucose in the blood activates PFK1 so that it can help with glycolysis. That is it. I hope you guys like the video and find it useful. Thank you.